Well, I think the fact that a matron has been appointed is a reflection and an acknowledgement of the fact that there have been some major reforms that have been carried out over the last 18 months. Just to mention the highlights. You may recall that a child and young person's psychological service was started in January of this year. We have recruited from 2.5 psychiatrists to 4.5, the 0.5 being a part-time position. We've also increased the number of psychologists, and we have our most recent addition mostly based at Ocean View to provide therapeutic support to our inpatients. We've also increased the number of mental health nurses, and we intend to announce even more reforms during the course of this financial year. And I realise that even though K. Raj Kumar, who's my clinical nurse manager for mental health services, is doing a fantastic job, I did realise that because of the additional number of services that we were introducing, that she required some support managerially and also clinically to be able to coordinate the different services. Because my concern, both in mental health services, whether it's in acute mental health services or whether in any part of the health services, my concern is that when a patient goes into the system for whatever reason, whether as an outpatient or an inpatient, that the patient does not get lost. And as we add services, it is imperative that we have a bird's eye view of the patient from the moment that that patient comes in to the moment that that person leaves, and that there are no gaps in the service.
So tell us about what Vikki Ward, the new matron, will actually be doing.
Well, I think it's important to talk just a little bit about Vikki Ward and the fact that she has been with the GHA since 2009, and she was promoted to ward sister just 2 years later. So she will have gained invaluable clinical and managerial experience in that time. The role of matron, as you will recall, was reintroduced in a modernised fashion in 2017, and we have 2 matrons based at St Bernard's Hospital, and matrons provide a reassuring, authoritative figure that coordinates care. So you have your multidisciplinary teams, and of course that's comprised of many different professionals. And again, within that structure, we need to remember that the most important person is the patient and the care that we're providing. And so the matron will be able to ensure that we maintain and we excel even more on the standards of care, and that she ensures at all times that there is highly competent, professional and compassionate care of our patients.
And how will the end user actually benefit in terms of waiting times, for example?
Well, I think a matron will do many things, and I think her presence will be noticed immediately. I mentioned about coordination. Now, in different parts of Europe, the target for patients to see a psychologist is, believe it or not, 18 weeks. And they say that if a patient sees a psychologist within 18 weeks, that's a very good thing. In Gibraltar, we've been able to reduce that from 8 weeks in September of last year down to 6 weeks. And I know that with Vikki now as mental health services matron, she will be able to bring that down even more to hopefully 4 weeks. And so it's that element of being able to coordinate all the different services, ensure that the patient is receiving the care that he or she needs, that she will be able to deliver, along of course with all our professional colleagues and our clinical nurse manager and general manager.
And are you planning on recruiting any more matrons, or is this it?
Well, as I said at the beginning, the reason for the mental health services matron is because of additional services. The matron will be in a unique position to be able to tell me, as we roll the additional services that we are yet to announce during the course of this financial year, or of course it probably will be during the course of the next financial year, because we're reaching the end of this one, whether we need an additional matron or more mental health nurses or other allied health professionals, or indeed more consultants.